Hello, and welcome to the educational video regarding the treatment of diabetic ketoacidosis using the two-bag system. Diabetic ketoacidosis, DKA, is a common and life-threatening complication of diabetic pediatric patients. The defining characteristics of DKA include a blood glucose greater than 300 milligrams per deciliter, ketones in the blood, a blood pH less than 7.3, and a serum bicarbonate level below 15 milliequivalents per liter. Common causes of DKA include infection, inadequate insulin treatment, new onset diabetes, and cardiovascular disease. Electrolyte imbalances and neurological changes are commonly associated with DKA, making it especially dangerous. So, why is DKA so dangerous? Well, a patient with DKA can quickly decline if untreated from complications such as cardiac dysrhythmias, seizures, and cerebral edema. One very successful treatment option for DKA is that of the two-bag system protocol. The two-bag system for delivery of dextrose and fluid administration in the acute management of children in DKA allows unrestricted variation of dextrose and fluid delivery to the patient and enables faster response times in making IV fluid adjustments. The two-bag system design allows the IV fluid therapy to be individualized to the child's evolving needs. This protocol must be ordered by a physician and allows for appropriate correction of the acidosis and blood glucose levels. In this scenario, a 10-year-old patient who weighs 33.6 kilograms presents with signs of hyperglycemia, including polyphagia, polydipsia, and polyuria, and a blood glucose level of 350. To complete the two-bag system protocol, you'll want to begin by checking your facility's policies and procedures. You'll then want to confirm your doctor's orders for the system and gather your supplies. You will need multiple sets of primary tubing, an insulin drip, dextrose 12.5 and 0.45% sodium chloride with 20 milliequivalents potassium chloride per liter plus 20 milliequivalents potassium phosphate per liter, and 0.9% normal saline with 20 milliequivalents potassium chloride per liter plus 20 milliequivalents potassium phosphate per liter. Once you have the necessary equipment, you can enter the patient's room.
Okay. Hi Anna, my name's Brett. I'm going to be your nurse, and today I'm going to be treating you for your DKA. So we're going to start a couple bags of fluid, and before I do that, I'm going to verify your identity on your band, so your name, Anna Tarsova, date of birth 10/9/20XX, MRN 787344, and I'm going to go ahead and check that against my MAR and my physician's orders. And then I also see that you have an allergy to peanuts. So before beginning to run her fluids in the insulin drip, we would check her blood sugar levels and go through our math to determine exactly the ratio that we needed to run. So our patient's weight is 33.6 kilograms, and based off of our unit protocols, she would get insulin at 0.1 units per kilogram per hour for 3.4 units an hour. And then the maintenance fluids, you can see here, we've worked out the math for the maintenance fluids to reflect the protocols, and this is what we have. So the first bag will start at 111 milliliters an hour with bag 2 at 0, since her blood sugar check was 350. Before hooking our bags up, we're going to assess our IV site and make sure it's patent. So go ahead and remove the cap and swab for 30 seconds. Okay, so after 30 seconds, go ahead and make sure the IV is unclamped. Remove any airs from our syringe. And we'll give a flush. And so while we're flushing, we're just going to look for any signs of infiltration, swelling, or coolness around the site. The bags that we're going to be using are our bag 1, 0.9 normal saline with our electrolytes of 20 milliequivalents KCl and 20 milliequivalents of KFOS. Bag 2 is going to be D12.5 plus 0.45 normal saline with electrolytes 20 milliequivalents KCl and 20 milliequivalents of KFOS. And then finally we'll have our bag containing our insulin. So the first bag that we're going to connect is going to be bag number 1, the 0.9 normal saline. So it's already been primed and placed into the pump. So what we're going to do is push channel select, guardrail IV fluids, and then we'll select our 0.9 normal saline with our 20 milliequivalents KCl and KFOS. And we'll say yes. Okay. And so the rate based off of our blood sugar of 350 is going to be 111 milliliters an hour. So we'll program 111. And the volume to be infused, we're going to program 111 again. This way our pump will alarm in an hour, signaling us that we need to come back and check the blood sugar to make any further adjustments. So we still have our clamp closed. And we're going to come over to the IV site and we will clean for 30 seconds. You can also see we have the lines labeled so we know exactly where everything is and what is going where. So once we have it attached, we can push start and unclamp. So the next bag that we're going to hook in is going to be our insulin bag. It's going to be run at 0.1 units per kilogram per hour. And this bag is concentrated at 100 milliliters and 100 units, so it's a 1-to-1 ratio. So I've gone and selected insulin and placed my numbers in, and you can see I have a rate of 3.4. The volume to be infused will also be 3.4, so it'll alarm in an hour, and the total dose is going to be 3.4 units. So at this point, since insulin is a 2-nurse check, I'd have my second nurse come in and take a look.
So here I'm going to be looking to see that everything is correct and it matches up to the protocol. So I see here that we're going to be infusing at a rate of 3.4 mLs, and we're going to also infuse at a total of 3.4, and our dose is going to be 3.4 units per hour based off the kilograms and what we calculated. So it is correct.
We'll go ahead and we will attach our line. So we will go ahead and clean the next open port, remove our green top, and connect the insulin in. Okay, so now I'll come back and push start and open my roller clamp. And now we're infusing 3.4 units of insulin.
We hope you have enjoyed watching this educational video on the treatment of DKA using the 2-bag system. Thank you.